I am Rosalind Ryan, and I am the CEO of HealthFox US. And I am also the co-chair for the WEDI Genomics Workgroup. And today we have a wonderful treat for you. And in the interest of full disclosure, I do want to tell you that I am a member of GA4GH, which is where our speaker is from. They are a standards organization that helps put together standards on genomics globally. They have membership from countries all over the world that are all working on getting standards and getting work aligned so that we can better start to use genomics in medicine. And I think their story and the story about the work they do is fascinating. And that's what Lindsay will be sharing with us. Lindsay is somebody that I have worked with and come to respect tremendously for all that she does. She is the work stream and clinical project manager at the Global Alliance for Genomics and Health. She manages international teams developing standards for the responsible sharing of genomic and health data. So at this point, what I would like our agenda to be is I'm going to let Lindsay speak. We were also supposed to be joined by another speaker from GA4GH, but unfortunately she isn't feeling well today. And so the entire presentation is going to fall on Lindsay's more than capable shoulders. Then what I was thinking is after we do that, we'll allow some time for question and answers. And then I just want to do a real brief mention on NIST's request for more information, and we can talk about that for the last few minutes of the meeting. So without any further ado, Lindsay.
Fabulous. Thank you so much, Rosalind, for that introduction. And hi, everyone. I'm just going to get my screen shared on the slides here. Okay, hopefully everyone is seeing that okay. So great. So as Rosalind mentioned, oops, sorry, I'm just going to actually hang on. I'm going to switch screens here. So I'm looking at the slides on this screen and not on my other screen. Moment. We are looking at that one. Let's see, wants to go. There we go. Okay, apologies about that. Here we go. So as Rosalind mentioned, I am the Workstream and Clinical Projects Manager at GA4GH. So what that means is that it's my role to manage 2 of GA4GH's 8 work streams. I'll talk a little bit about what that means in this presentation. And also, as Rosalind mentioned, I was going to be joined by Mally, who is our policy analyst, and Staff Rue's regulatory and ethics expert. Unfortunately, she wasn't able to join us today. And so just as a little bit of context as well, I'm based at the Ontario Institute for Cancer Research, which is based in Ontario, Toronto, Canada. Just as a brief overview to give you a sense of what I'm going to talk about today, I'm going to talk about why GA4GH exists, why we do what we do, a little bit about how we work, our structure, how we create the different standards that we have. And through that, I'll talk a little bit about the approval process as well. We have different processes depending on whether it's regulatory and ethics topics or something more technically oriented. And then I'll talk a little bit about our regulatory and ethics work stream and the work we do there. And then I have a brief couple of slides at the end about how you can get involved in our work. So I'll kick us off with setting a bit of a stage here. So slide. So, in the last few decades, genomics has seen massive and ongoing changes in technology. Over 20 years ago, the Human Genome Project took over a decade and thousands of researchers. It cost around $3 billion to sequence that genome. Today, sequencing can be done for less than $1,000. It takes less than a day. And with all of these, rapid advancements in technology, healthcare providers are in a position to offer whole genome sequencing and other, large-scale genomic technologies to patient populations at a very affordable cost. In addition to that, we've also seen growth in the number of genomics data initiatives globally. So there are more than 200 genomic data initiatives around the world today. And together they are generating huge amounts of genomic and health-related data. And so this is a graph kind of showing where we expect, genomics to be in the next couple of years. We're going to see this explosion in the number of genomes being sequenced. A lot of those genomes are going to come from a medical or clinical setting. We're seeing data is increasingly coming from clinical care and clinical trials research rather than academic research, which is where a lot of those genomes have been generated traditionally. And by the end of this decade, we expect also that large volume of genomic data to be stored in a cloud rather than on-premise solutions. So there's going to be this big explosion in availability of genomic data in the coming years. And so there's an opportunity here. If we can enable secondary use of that clinical data that's being sequenced, we can enable that use for research, we can create these virtual cohorts of samples and of patients, which we can use to analyze and inform patient outcomes. And so if we can create this virtual cohort, this will enable a host of downstream impacts for both research and precision medicine. So we can demonstrate patterns in health and disease. We can increase the statistical significance of our analyses. We can have stronger variant interpretations as well as increase accurate diagnoses. And all of these would lead to progress in genomic science and human health. A great example of this is how genomic data sharing on a global scale has led to discoveries during the COVID-19 pandemic. But that brings up some big questions for us. How can we make use of all of this data? How can we create bridges between research labs and the clinic so that all of that discovered knowledge can be put into practice? And so we face a number of challenges, such as how do we develop that infrastructure and technology to deal with all of this data? How do we build trust with patient and partner communities? There's all kinds of regulatory and ethics questions we have to think about, like consent and privacy. How do we make sure that that data is secure? And so as a community, we're working on it, we're making strides, and we're certainly seeing, an increase in the number of countries that have connected their things to healthcare systems and created, genomic biobanks globally. And so there's really a growing trend here, but with that trend comes a number of challenges. And since all of this data is distributed globally among these different labs, initiatives, genomics programs, we need interoperable standards to answer the research questions we have. These interoperable standards will, help us enable that data to talk to each other and communicate among these different groups. And so that's kind of where GA4GH comes in. We just had our 10th birthday. I think actually our 10th plenary was last year. I think our birthday officially is this year. And we are a global network of professionals that are building these standards for genomics. And so the GA4GH mission, how we tackle these challenges in genomics, health, and data sharing. So GA4GH, Global Alliance for Genomics and Health, is an international policy framing and technical standard setting organization with the goal of accelerating progress in genomic science and human health by developing standards and framing policy for the responsible sharing of genomic and health related data, or maybe related health data would be a better phrasing. We focus on human genomics and human health. So kind of not just genomics, but also phenotypic information or other information that would be helpful for genomics research. We were founded in 2013. And, our ecosystem of participants and organizational members spans a huge swath of the globe. So we have 50 plus countries that are involved in our work. We've produced more than 30 technical standards and more than 20 regulatory policies and frameworks. All of these things that we've produced are completely open source. They are created by, a lot of volunteer contributors from the genomics community. And they really enable research and healthcare systems to learn from each other in order to benefit, people and patients everywhere. You'll also see on this slide, we mentioned these active participants and 4,000 subscribers. What we're referring to there is about 450 plus people are actively involved in writing and contributing code, whatever it might be, to our standards. And then we have another 4,000 that subscribe to our mailing list, or perhaps they attend our meetings, that sort of thing. We have 8 work streams, which I mentioned. I'll talk about those on the next slide. And we also have something called driver projects, which I will also explain in the next slide. So what this slide is showing here is really a summary of how we work. So we produce our genomic standards and policy frameworks via these 8 different work streams. These are shown on the, so we develop all those frameworks and policies during these 8 work streams. These are shown on the left-hand side. You can see they're split into technical and foundational. The technical work streams are where we build the technical standards, not surprisingly. These cover a wide area of I guess a wide span of thematic areas, cloud genomics, phenotypic and clinical data, genomic knowledge standards, which is about variant representation. And then we have these foundational work streams in regulatory and ethics and data security. They're called foundational because they really are the basis of a lot of our other work streams as well, and provide security and regulatory and ethics feedback and support to the development of our technical standards. They also create their own standards as well, of course. And so in order to create the standards in these work streams, we collaborate with partners all around the world. We do have a core set of projects we interact with called driver projects. These are the groups shown on the right-hand side. And they help develop our standards by providing use cases and actually test them in the real world. So, GA4GH does not host data. We don't do research, but we work with the organizations that do sequence a lot of genomes, that are trying to share data between different institutions. And so you can see, as an example, we have several large or prominent, I should say, genomic initiatives such as Genomics England, Australian Genomics, the Elixir Infrastructure Network, the Swiss Personalized Health Network, and so on, that are all providing input into our standards and acting as the proxy to the wider genomics community to make sure that what we're creating is useful and valuable and needed in the community. And so I just wanted to make a quick note that everything we do in GA4GH is based on a foundation of human rights. So one of the first things that we ever created was the GA4GH framework for responsible sharing. And so this framework provides guidance for the responsible sharing of human genomic and health-related data. And this framework really is guided by Article 27 of the Universal Declaration of Human Rights, which guarantees the rights of every individual to share in scientific advancement and its benefits, as well as the right to recognition. And so this framework, if you're interested in reading it, is up on our website. We've translated it into I forget what number we're at now, but at least 10 different languages. And really everything we do in GA4GH is based on this principle. And so just as a bit of context on our ecosystem as well, we align with there's many standards organizations that are developing genomics related standards, and we work in close partnership with many of these. So you can see us at the blue bar in the middle here. Typically, we came from a more academic or research-based, what's the word I'm looking for? We started in a more academic or research-based community, and we're gradually expanding that work to apply to clinical data and clinical applications as well. So that's why you'll see our circle kind of a little more on the research side, but we span this whole spectrum of research to clinical care. A number of our groups are working with HL7 and developing implementation guides for work with HL7 FHIR. We have partnerships with, or doing some work with SNOMED, which of course is a clinical terminology, CDISC, and then we also have liaison representation status in a number of ISO standards development groups as well, and those are shown on the bottom here. So if we do manage to create that feedback loop between healthcare and research, we can achieve what we would call the global learning health system. And so this idea of a learning health system describes a continuously adapting system in which data and analytics generate knowledge. That knowledge is implemented into practice. that generates new and better data, which can then feed back to generate more new knowledge, and it creates kind of this ongoing virtuous cycle that you see kind of represented here on the screen. And so this is showing an example of a learning health system and how it could potentially play out. So, we have the data donor, and patient obtaining consent to collect their information. That data moves into responsible storage, so it can be accessed for secondary research. Through, analyzing that data set, sharing it, it's all leading to improved knowledge, and that can eventually kind of circle back and inform human health and medicine. And the standards GA4GH produces plays an integral role in each step of this data lifecycle and in the learning health system. And so you can see now, and all of the not all of them, many of the standards we've produced are shown here in this cycle. And I'm not going to go through every single one of these today, of course, but just to give you a sense that we really cover a wide span of this life cycle. And I think beyond this, GA4GH resources are flexible, so they can be adapted to other contexts, other systems, and they can work together in different ways. So I wanted to touch really briefly on the GA4GH standards approval process and how we create our standards. And so we really prioritize, global or common use cases and patterns. What this means is we try not to make anything that is specific to a particular country or jurisdiction. We prioritize creating something that everyone can use. And if everyone can use it, that promotes interoperability. We work with real projects and data custodians. So this was kind of implied in our driver project model, but we really want to create things that people use. And so we use those projects that have those needs to really define the work that it is we do. And again, related to that, we really want to prioritize something that is achievable and will have impact. And so kind of building on that idea a little bit, a lot of the work we do is iterative. So, sometimes you might create a version 1 and it's a good version and it's usable, but then we get that out and tested, we refine it, release a new version and so on, following software development principles. And so on the bottom of the screen here, you'll see kind of a rough mock-up of what our standards development process looks like. This is a very, very simplified version. I'll show a complicated version on the next slide. But essentially what happens is, an initiative or a group of initiatives might approach us with a certain challenge or problem, or maybe they have a solution in mind already. They would bring it to our community, and we would develop that into a standard. And what that means is, of course, finding the stakeholders, doing a landscape analysis to see what else is out there. We really are not interested at all in duplicating efforts and really want to leverage all of the great work that's already done in the community. And there's a span of time there. It can take anywhere from 1 to 2 years, say, to create a version of something. And then we have quite a process to go through at the end, where we have a product review committee that reviews our standards. We have regulatory and ethics experts review our standards. We have security experts review our standards. And then all in all, there's a vote at the end for whether we would approve to release this standard out in the community and for use. I mentioned we have a slightly more complicated version of that. This is only a piece of it here. If I had the whole thing, it would probably be tiny, tiny text and expand way off the slide. But I really just wanted to get the point across that we really emphasize broad outreach and engagement and bringing the community into the process. And so you can kind of see on the slide here, there's several different options or ways a standard could start to be developed in GA4GH. Someone might have an idea, they might have some sort of issue and they don't know what they need quite yet. They want to update something we already have, or maybe they have a fully developed standard outside of GA4GH that they want to bring into GA4GH. And there's these series of checks and steps that have to be passed in order for something to go through GA4GH. So, is there something already out there? Who do we need to bring into this community? Which stakeholders do we need to engage? Do we have the use cases in real world use cases to support this issue that you have? And so I'm not going to go into all of the details there, but just to kind of give you a sense of how we do the different projects and how we develop the standards we have. And so this piece I've already talked about a little bit, but it is an iterative process. So we collect use cases from many sources. We learn from the implementation of our standards and its integration into real world projects, and then use those learnings to refine and develop the standards further into really robust resources for the community. So I'm going to switch gears a little bit and now talk about some of our GA4GH work streams. I'm only going to talk about 2 of them today because I think it's of most interest to this group. I'm first going to talk about data security. And so I guess as a bit of a preface, this is not one of the groups I manage, but I can tell you a little bit about the projects that are ongoing in this group. So the data security work stream is really about helping the community keep genomic data protected and ensure that standards are developed within a risk management framework. And so, really what it is that this group does is develop solutions in a variety of key data security areas. And so in this bottom right-hand box, you can see a listing of the names of a couple of our different standards. I'll talk a little bit about some of them now. The left side as well, the bolded ones are standards that we have released. They are available. You can go to our website and check them out if you're interested. The ones on the right-hand side are projects that are under development. So you can't access these immediately from our GA4GH.org website right now, but if you were interested in this and wanted to join the data security workstream, we could share some of the resources from those projects with you. So to talk briefly about some of these things, starting off with AAI, this stands for Authentication and Authorization Infrastructure. So this is a GA4GH approved standard, which actually is used in conjunction with another one of our standards called passports. And what these 2 standards do together is reliably authenticate a researcher's digital identity and automate their access to requested genomic data sets. And so I can't talk about all the technical, software development terms of how that works, but it really is, as the name implies, with AAI and passports, it's a digital passport for researchers to be able to access data sets of interest. We've also developed a data security infrastructure policy. And so this document describes the security infrastructure policy and technology recommendations for stakeholders in the international genomic data sharing ecosystem. And then we also have a privacy and security policy, which really aims to guide the sharing of genomic and health-related data in a way that protects and promotes the confidentiality, integrity, and availability of data and services, and as well as the privacy of individuals, families, and communities whose data is shared. And on the right-hand side, so there's a couple of projects ongoing. One is in cloud security and privacy. This is really expanding on the work of our cloud work stream, which develops different standards to share and ease workflows in a cloud. So they're helping to write some policy around the use of those. Oops, sorry, too far. We're also working on something new called malfeasance rules. So how you might be able to detect whether someone is using data as they said they would. And the risk assessment methodology, as the name implies, is going to be a document to support developers assessing risks of different security protocols they might have in place. And so now I'm going to spend the last bit of my time here on the regulatory and ethics work stream. This is one of the work streams that I manage, although I will again say I am not a bioethicist or lawyer, but all of the contributors to our community often do have that expertise in our groups. So the regulatory and ethics work stream, as I mentioned earlier, in relation to GA4GH overall, is also built on this foundation of the Universal Declaration of Human Rights. And so this work group really aims to develop policies and tools to harmonize and address regulatory and ethical hurdles to genomic research and international data sharing. And then I also noted that they do reviews of our technical standards. And so when technical standards are up for approval, our regulatory and ethics work stream will also, provide feedback as to how well those technical standards are addressing, different implications there and any sort of considerations or ways they could change the standard to make it more ethical and responsible for genomic data sharing. And so this slide here is really to show kind of the timeline of RUSE over the years. RUSE was one of the very first work groups of GA4GH back in 2013. And of course, we released the framework in 2014, just after that. And so RUSE is really all about activating, that human right by developing forward-looking data governance policies. We've released consent templates, for example. What's another policy frameworks that are really harmonized across countries, sectors, and institutions. And so, everything RUSE creates is globally applicable, or at least is generalized enough that anyone from any jurisdiction could take some of the resources RUSE has produced and, modify them, tweak them as needed to fit their context or their jurisdiction. And so on the right-hand side is of different RUSE products we have developed over the past couple of years. Again, all of these are freely accessible, available on the GA4GH website. We have a RUSE toolkit where you can go through and see all of these different products. But what I'd like to spend a bit of time now is talking about some of our current projects and things we're working on now. And so I'll give a quick overview of what we call RUSE subgroups. Within all of our work streams, we have different groups focused on different topics. And so these are some of them shown on the slide here. If you have any questions about any of these groups, I'm happy to go into more detail as needed, but at least for now, I'll just kind of do a little bit of an overview. And as well, if any of these topics, really pique your interest and you want to hear more afterwards, I've put the email down at the bottom there, ruse-coordinator@ga4gh.org. Please don't hesitate to reach out to us. We're happy to provide more information. So starting us off, we do have a project right now in diversity in data sets. This is a very prominent topic about how we can improve the diversity and representation of genomic data sets. And so this group is developing a policy which provides guidance for researchers using genomic data on how they should be thinking about diversity in data sets for the purpose of their own research. And so in order to kind of guide this work, they have two use cases to demonstrate this in practice. One is for variant interpretation, and then there's another one, I think, for polygenic risk scores. And so they have just drafted a draft policy that they're talking about actually right after this. There'll hopefully be it's a really interesting paper, and hopefully that should be available out soon. The ethical provenance toolkit is, again, a fairly new project in RUSE, and it is linking policy, ethical, procedural, and technical tools that facilitate the biomedical data lifecycle by creating tools that can promote the transparency and consistency in ethically sound genomic research. And this is really an extension of one of the previous projects in GA4GH about data access committees and how we can support data access committees in their approval and review of data access requests. And so this is really looking at, how we can, look at the provenance of data over time. And so the first task this group is looking at is collecting, analyzing, and synthesizing data access agreements. And so I think one of the first outputs they're going to share is either a harmonized or a template data access agreement that any group can use to help create their own data access agreements. Clinical data sharing and consent. So this group really stemmed out of some of the work of initiatives like ClinGen, ClinVar, and whether or which data you could share, depending on the clinical context you might be coming from. And so this group is identifying best practices for consent standards for sharing clinical data to support things like variant interpretation. Because sometimes there is kind of a gray area in terms of what you can share for what you can share for clinical care versus what you can't. And so this group is looking at what types of data can be shared where explicit consent is or is not required. And then lastly on this slide, we do have a group called the GDPR Forum. GDPR stands for General Data Protection Regulation. It's a very influential document in Europe. And so this group is discussing and disseminating information regarding European data protection law and its impact on international genomic and health-related data sharing through a series of blog posts. All these blog posts they're really accessible. They're up on our website as well. We've got one coming out, I think, in the next month. And our authors really dive into the different clauses and legalese around the GDPR and how it can affect data sharing across different nations. And so the last thing I'll just touch on regulatory ethics here is just a couple of our other groups. We have one in genetic discrimination. So this group is exploring the meaning and implications of genetic discrimination in collaboration with an international group called Genetic Discrimination Observatory, or GDO. And so these groups work, our subgroup and this GDO group work collaboratively to develop policy-focused outputs. And so last year, they published a genetic discrimination information document about the implications for data sharing projects and what you might want to think about in terms of genetic discrimination. And so it provides information about key topics such as genetic discrimination, as well as terminological aspects such as what available evidence is out there, what existing protections are out there, and how does consent play into this topic of genetic discrimination. And currently, this group is working to define what genetic discrimination actually means, and looking to move on to discuss the idea of group harm and group genetic discrimination. And they have a paper that's going to be coming out soon, as well as a policy they're writing as well. The Data Access Committee review standards, I touched on this one a little bit, but this group is about harmonizing Data Access Committee standards and considering the role of automated decision support tools to create, an evidence-based toolkit for data access committees. This group has already released a policy about guiding principles and procedural standards for data access committees. And so this really provides, how you can operationalize guiding principles and procedural standards to create greater trust in the data access committee review process, and also across institutions, repositories, jurisdictions, and so on. Lastly, I'm just going to touch on the public attitudes for genomic policy one. This group, similar to the GDPR forum, is developing briefs to disseminate, very publicly accessible briefs to disseminate the findings of the Your DNA, Your Say study. If you're not familiar with the Your DNA, Your Say study, this was a large international study to explore community and patient perspectives on trust of genomic data sharing, whether trust is greater if you're sharing that information with a clinician versus an industry group, for example. They looked at all kinds of different things like opinions on return of results, opinions on benefit sharing and genomic data sharing, some really interesting outputs from that. And so this group is taking the Your DNA, Your Say study, as well as any other public attitude surveys, and kind of turning them into these briefs to inform GA4GH and other groups on how they could take these learnings and apply them into data sharing policy. And so this group has already published a first brief. Again, it's already available on trust and trustworthiness in genomic data sharing. And they're finalizing a couple of other blogs on familiarity, return of results, and genetic exceptionalism. So this concept of genetics being more special than other health information. And then just to wrap up the ruse piece here, this last group at the bottom here on newborn sequencing, this is a group we haven't officially launched in regulatory and ethics yet, but we're hoping to explore. The outputs and direction are still in progress, but the idea is to explore the ethical and regulatory landscape relating to newborn whole genome sequencing and maybe create some sort of best practice or tool that might be useful for the international community. And so I just have a couple of last slides here to wrap up. To further expand our GA4GH community, we've launched an open call for driver projects. And so as I mentioned, driver projects are the initiatives that both develop and test drive GA4GH standards. And so if you know of an organization or from an organization that might be interested in this, there's a link to the application at the top of the page. We're really looking to broaden our global representation in our GA4GH driver project cohort. And we're really looking to work towards 3 imperatives, and that's making our standards interoperable, making them easy to implement, and really collaborate with the clinical world. And so what you're seeing on the slide here is kind of the 4 criteria that these groups might be evaluated against. So just shameless plug if you know anyone who might be interested in this. I also wanted to add briefly that our next big meeting is coming up in September. We will be in San Francisco. The location isn't confirmed yet, but it'll be at the end of September. If you haven't attended one of our plenary meetings before, they are big public-facing events where we dive into all kinds of topics related to genomic data sharing. We talk about what GA4GH is up to. We have fireside chats with experts in the field, and I might be biased, but it's a great time. So, if you're interested, I'll certainly make sure the information is shared later on this year. Lastly, I also want to highlight that the contributors to our standards come from all kinds of different backgrounds and roles. They might be clinicians, they might be researchers, patient advocates, software developers. And there's really a number of different ways you can contribute to GA4GH. We have volunteers who lead the work in these different groups. We have use case champions that typically come from our driver projects and provide the background and context to develop our standards. We have software developers and maintainers of the technical side of our standards. We have people that might not participate in the group as regularly, but will comment on things when they are open for public comment. We have people who don't develop our standards, but then implement them after the fact. There's really a whole range of ways you can interact with GA4GH, and I always like to call it a choose your own adventure. And, we can find a way for you to work with us that works well for you and your interests and priorities. And so with that, I will wrap it up there. Thank you so much for offering or for providing me with this time to chat about GA4GH. Happy to answer any questions. If you want to reach out to me, you can do so at the email at the bottom there, ruse-coordinator@ga4gh.org. That will go to myself, to Mally, who unfortunately couldn't be here today, as well as one of our other staff Ruse members. And so I will pause there. And again, thank you and happy to answer any questions.
Well, thank you, Lindsay. That was absolutely amazing. And I hope everybody that attended this meeting had a good chance to see the process of how standards are created and the way that GA4GH kind of looks at the entire industry in terms of thinking about what happens with the data, what questions need to be answered, how you approach everything from knowledge and security and actual use cases to making sure that there is a way to be able to trust the data and to be able to continue those discussions about what it is that defines that trust. So does anybody have any questions that they would like to ask, whether it be about GA4GH or any of the kinds of things that the organization does, or about standards, or about genomics in general?
I had a question that was sent to me direct message, and the person just wants to know whether individuals know their genetic information will be used or shared and what privacy protections are in place for international data sharing. I know she went over this, but if we could just go even deeper into it, that'd be great.
Yeah, so that really depends on a lot of the institutions and organizations that are collecting that information. So, typically for data collection, there would be some sort of consent process that would happen when that data is being collected. And I think a growing trend we're seeing now is providing the power back to patients and providers of genetic information to really have control over how their data is shared, who it's shared with, how, when, for example. And so I'll take one of the standards we have as an example. We've created an ontology called the data use ontology, which allows implementers of the standard to tag data sets with usage restrictions. So say, for example, a patient or provider of genomic information said, I only want my information to be used for cancer research, for example. The data stewards who are handling that data could tag that data set with, cancer use only. And so it would only allow access to that based on, people who are doing cancer research could access that information. And so that provides kind of that assurance and protection to the patient that their data is being used how they want it to, and also kind of that extra layer of security there. And there's some good examples of initiatives like Australian Genomics has something called Control, which is essentially kind of a portal that data providers could or patients could log into. And you could go in and say, I no longer want to share my data, or I do want to share my data with this thing. And it kind of it changes the idea of consent from being this one-point process to being an ongoing process, where those patients and providers can really have control over how their data is used and when. So I hope that answered the question.
So one of the other things is that's a perfect segue into talking about what NIST is requesting information on. They're really looking at specific practices in risk management, in cybersecurity and privacy management to get a feel for what some of those issues are and how we put those protections in place. And really what their main focus is to do it across a data lifecycle, not just at the point of collection. And I think that's part of a growing trend. And we've talked about this in RUSE. We've talked about this as being sort of the wave of the future, where because these data sets are used ongoing, and as more things are discovered about genomics data, and given the fact that your sequence is your sequence, regardless of when it's taken, and it pretty much stays the same, you might consider different applications as you go through different stages in your life and what you want to have permission for and the kinds of things that you don't want to grant permission for. And I think their request for information is very much moving along these same lines that Lindsay just talked about in terms of looking for real life use cases of different kinds of things, like perhaps the Australian genomics requirements, and also policy enactment for the future. What are the kinds of things that we can foresee coming up in the future that talk about the kinds of ways that this data is going to be used, how people feel about it? I know that GA4GH has done a ton of work on consents and permissions and data security and other kinds of things, mostly trying to get a handle on all the different options and then providing very stable, very ethical ways of using that data so that it's set to reduce the amount of harms that could come from either bad actors or people accessing data that the patients themselves do not want them to be able to have. And I think that's kind of changed a lot over time and is now coming to the point that that's written into a lot of data security and data privacy rules and regulations. It's not just simply, do you give your permission or not? And, for most of it in the very early stages, when a lot of the private companies were doing sequencing, their rules, basically put the data into their hands and sort of gave them blanket permission to do whatever they wanted with the data without having to come back to individuals for their consents in the data being used. And I think that created a tremendous amount of problems, both in terms of the harm that was done to those people by not honoring their wishes, but more so by turning the industry into being more fearful of genomic data and the collection of more genomic data, because they really didn't feel secure that these companies would honor what they wanted to have done. And I think in terms of a regulatory influence, that has done more to put some regulations and stop group backs and just ethical considerations into the mix to kind of assuage those people in terms of saying, we're not that, we are not just collecting and going to use it anywhere we can. And I know we've recently seen in the press, in this country tremendously, where there is a backlash against people that are using information in ways that they didn't state up front, and in consumers actually saying, wait a minute, that's my data. I get to determine what you do with it, and having you use it as a means of for-profit gain without my direct permission to do so is no longer viable.
Yeah, I'm just going to share a link because I think this is such a great initiative. For those who haven't heard it, it's called RareX. It's actually a patient-powered platform. So essentially where the power of data access is put on the patients that are providing their data. So I just put a link in the chat if you wanted to check it out. This is one of the initiatives we work with, and I think it's such a great approach to data sharing and ensuring that patients are comfortable with how their data is being used.
So does anybody else have any questions or comments? We are not going to submit a formal response by WEDI on the NIST request. And that's because as an organization, we're still in the beginning stages of educating and bringing in different speakers with knowledge in different areas pertaining to genomics. But it is exactly this kind of request that we will be asking the genomics work group to get together and respond to in the future. Because I from at least from my perspective, as someone who has done genetic testing and does have that data out there, the positive, it was used to help treatment for me directly that saved my life. The negative is that information without the right protections could go to bad actors that might use it to either discriminate against me or find a way to punish me for having gone through an illness that really had nothing to do with what I could control or not control. So I, for one, am very excited to see these new rules and regulations coming in to protect and encourage people to use genomic data for their health. Anything else? Anybody want to bring up anything?
I'm also happy to answer questions via email if as you're percolating and something comes up later, please don't hesitate to email me.
Same here, and I am going to put my information into the chat as well in case anybody wants to reach out to me directly too. So thank you all for attending, and certainly thank you, Lindsay. That was an amazing presentation, and we're very happy to have heard all that you shared with us.
Thank you for having me. I really
Everybody.
appreciate the opportunity. Thanks,
Okay.
everyone.
Bye.